My deputy governor is here. I can see the chief whip of the National Assembly, Honorable Wangwe. We have regional commissioner, county commissioner, and officials, county officials from both, government officials from both the county government and the national government, and members of the Fourth Estate. Good afternoon. I want to take this opportunity on behalf of the people of Kakamega to welcome you, CS Health here, and to thank you very much for sparing time to come to be with us today. This is a day that we have been waiting for, and it's good that it is happening today. I will give you a brief history about Kakamega very fast. Kakamega County has 330 health facilities with nearly a population of 2 million people. And out of that 330, 190 are public health facilities. As a county, we have averaged our budget allocation of about 30% to health sector. And this financial year, we have slightly increased it to 31%. The health department is the biggest. It has slightly over 3,000 staff establishments. Obviously, as a county, COVID-19 has had a negative impact on access to health delivery. In this respect, we have established that citizens are afraid to come to health facilities. And I want to take this opportunity to urge the those who are suffering from other health diseases, please to come to the health facilities, because we have taken precautions as a county, and you have seen how we have made sure that we have proper isolation hospitals or facilities in Lukuyani and in Mumias and where we are. The three are the three facilities that you have cassetted to take care of COVID patients, while other facilities, our citizens are free to go there to enjoy treatment of other diseases. And we have the entire general hospital, the other side, the level 5, which you can access without mixing with the COVID patients. And because we are not a COVID testing center, and CS, I think this is an issue that I have engaged you, that we need as a region, we have all to go to Kisumu. So our testing capacity is very low. We have managed to test 629 samples, out of which 596 tested negative and 33 have tested positive. From those who tested positive, 2 have succumbed to the virus upon arrival at the hospital. And 1, in fact, died immediately before he was admitted and was tested posthumously. The number treated and discharged so far are 28. So at the moment, we are only having two of them at the facility, and about another 3 are in their homes under the home care program. And those who have tested positive range from 1 year to 88 years. As I have mentioned, Kakamega County has no approved testing lab. The county is using Kemri lab for COVID testing. And I have submitted 2 requests to your office to consider making Kakamega a testing center. We have 6 skin expert machines for testing, which can be calibrated to test COVID-19. But the problem we have is obviously the reagents. We are unable to access the reagent because that is the responsibility of the national government. We have selected special staff. We have special staff who are dealing with these isolation centers. They have been properly trained and they were selected on a voluntary basis. I'm happy to report that none of our staff has tested positive. For referral purposes, we have 3 designated ambulances for COVID, suspected COVID infected people. The 3 ambulances are used for tracing, and when people are discovered, those are the ambulances that we use. We have also about 4,000 community health volunteers, and all these 4,000 volunteers have also been trained in partnership with the Kenya Red Cross. Red Cross is quite active here. Public sensitization conducted by public health officers in the county by the following groups and stakeholders have been involved: the Kenya Medical Training Center, the Kakamega Police Forces, the business community, the hawkers, all have been sensitized on the issue of wearing masks and etc. and social distances. Roadblocks have also been stationed in collaboration with the national government in all entry points for screening at the time of lockdown, and a total of over 1.5 million people have been screened. On communication, the County Department of Communication has continuously sensitized the community on COVID-19 through the local and the national media stations. The county government on its own has allocated 105 million for the fight against COVID-19, of which a number of items have already been procured and some are in the process. The national government dispersed to the county 262 million that was timely appropriated by the county assembly. And we are in the process of spending this particular money, but because it came late and because of the IFMI system, we have not spent the 262. We are still using the 105 that we allocated ourselves. The county also have launched a toll-free COVID-19 response line, number 0800-720-573, for the citizen to aid the referral of mothers and citizens to reach hospital and other facilities. The county has also innovated a way of using the local administration in collaboration with the community health volunteers to map out all pregnant mothers in the community to aid in the access of health facilities through border. We are grateful to the staff that we were allocated, and through that allocation, between July and December 2019, we were able to recruit 171 nurses, 26 doctors, and 13 clinical officers. I want to give my deepest gratitude to the rapid response team, which I chair and co-chaired by the county commissioner, and the sub-counties for dedicating their time in ensuring that we have systems in place to promote prevention as well as the management of patients that have tested positive for COVID-19. I would like to single out the staff in Mumias Hospital, which is our first isolation center, for the dedication they have shown in serving the initial positive cases that we have in Kakamega County. Lastly, but not least, all the health workers, I want to thank them for their timely effort and endless dedication in serving the citizens of Kakamega and beyond. I urge them to continue in the same spirit. CS, as you have seen, we are completing our first phase of this referral hospital. This is a peak facility that the county government has so far spent 2.6 billion Kenya shillings. We will be coming to you for the support of equipping this facility, and we are hopeful that in the next 2 months we will be ready to have this hospital used by the public. Otherwise, thank you very much. Now, I will want to give this chance